welcome all attendees to discuss with all speakers. And I saw that there was a raised hand of Evangelos Papas. So may I invite you first if you want to ask a question. Is there Evangelos Papas? I saw your raised hand. So don't worry if not. So are there any other questions to all our speakers?
Yes, I'm here, but I have no questions. Thank you very much.
Pardon?
I'm here, but I have no question. I thank you very much.
Yes, but I saw your hand. Yeah. Yes, so.
Eva, if I may, because I can see that we have eminent researchers here, and we also have a kind of audience of policymakers, both from a European level and from a national level. So we have representatives from the European Commission, we have representatives from the European Parliament, we have representatives from a number of national health ministries. And if you could maybe just ask our researchers and speakers, would you have a specific demand or question or priority that you would want national policymakers and European policymakers to address to make sure that we are getting better at preventing Alzheimer's disease?
I have not. So you mean, Jean-Georges, from us to them, eh? So that we want to ask them, yeah. So, well, I think start by saying that I think I enjoyed really all the talks. I mean, it was perfectly aligned and very impressive numbers at the end. And it goes to show how very important these biomarkers are to underpin and underlying the epidemiology actually that we were talking about previously. It was also always based on clinical phenotypes and dementia. But your figures clearly show that it has benefit to incorporate these biomarkers. And we know, of course, that that will increase the amount of people that actually have the disease and make the numbers only bigger. And the importance of the problem is actually increasing by that as well. But I would also urge all our politicians to get into the message outside that this is a disease that needs to be treated like we did with oncology, with HIV/AIDS and cardiovascular disease. And perhaps it's an open door, as we say in the Netherlands, but I can't say this enough because I still think based on the funding amount, based on the attention, there's a real discrepancy about between the field of oncology, where the prevalence of people suffering is actually as big as in our field, but the amount of funding into research and all sort of funding and actually also drug development in that sense is much, much, much lower. And this has to change, otherwise we will not win this battle ultimately. And we had now sort of a very small success with the aducanumab. It's just the first of many, many, many to follow, and they have to follow, because this will not be a treatment that is suitable for everybody. So we have to invigorate our research, but it can only work if we also expand the attention to the disease and the amount of funding to the level that oncology is now.
Thank you, Philip. Thank you.
Maybe I can follow up on this. I think there should not be the wrong impression that now that we have blood-based biomarkers and aducanumab, we have the solution for Alzheimer's disease. I mean, this is, I think, a breakthrough. It gives us new opportunities. But when you look back at the last 20 years, how many failures and how much money has been invested, this shows that the disease is very complex. We have these biomarkers, but we should not forget that it's a very complex brain disease. And to really have effective treatments which really keep patients stable for, I would say, a number of years, like 5 years really stable, we are very far away from this type of efficacy. And we really need to understand that this is just a first step of actually hitting the disease. And it's just a starting point. And Alzheimer's disease is a lot more complex than just amyloid and tau. This is very important to remember, and that is why after these positive steps, we need really to expand the research, also the fundamental research, and try to really get down to the interactions of mechanisms.
Yes, yeah, thank you very much. You are speaking out of my heart as well, because I think it is the opening the door, but the path is there, far away still to go. So thank you. And are there any other suggestions, Mia, please?
Yeah, I would say 3 points, and I mentioned them already partly, but first is really the increasing awareness, and there is still the stigma. So I think making dementia something we talk about is a brain disease, trying to communicate that in many ways, making it clearly the priority, because that is one of the big health challenges in all European countries, but even globally. So I think that increasing awareness is really, really one. The second, I think the prevention, what we already mentioned, there is something we can do already now, and we have positive numbers in Europe that the incidence of dementia has been declining in some countries, because probably we are doing already quite a lot, like the educational levels are higher, we take better care of blood pressure, smoking has reduced. So there is a good example that we can do something to reduce the risk. At the same time, as I mentioned, the COVID has really affected the lifestyle. There may be new risk factors like stress and sleeping disturbances. So we need to see the trends for the new risk factors and try to do something. So starting to implement these campaigns, risk reduction, again, I think is the right term we should use, but making action there, I think is the second. And finally, the third one, trials. I think it's so exciting with everything what is happening now. So really moving on with this field and seeing the complexity in Alzheimer's. Maybe there will be like the cancer care, like there are different subtypes. We will have different cocktails of medication. This is the start, but I think it's important to move on in this area now.
And I might want to add there that maybe at the European level, there should be some consideration about a specific trials program. I mean, we integrate our trials into calls, but we have the large potential in Europe. We have very many expert sites, very many experienced centers. And I think there are a lot of ideas with of trials by public funding. So not just industry-based trials. But it's always hard to find the right instrument for funding a large trial which is sufficiently long, which is like 4 years long, 5 years long on a European level. I think that would really make a difference.
I was coming to the something similar because I wanted to add the need for collaboration and for European policymakers here to look at this as not a European problem, it's a global problem. But from our perspective, it is a collaborative effort that we need, and public-private partnerships are with funding and the long-term ambitions are important there. And from my end and my perspective, it's a lot about data, having structures in place that allows us to work on a large scale across borders with data and setting up registers and collecting this. And while maintaining the integrity of our citizens, we should be able to use that type of health data. So I think that that is a challenge for policymakers, I think.
Yes,
thank you. Eva, if I maybe just interrupt for a moment, because you had the opportunity to ask policymakers questions, but we also have somebody from the European Commission who just asked whether she could ask a question, and it's Nicoline Tamsma from the Health Department of the European Commission.
Thank you very much, Jean. Can you hear me?
Yes, we can.
Excellent, excellent.
Welcome.
Well, thanks for putting that challenge on our plate, Jean. Thank you all very much for really interesting presentations. I work at DG Santé, so at the health side of the Commission, as Jean already said, at the unit in Luxembourg that works on mental health, NCD, prevention and promotion, so not the healthcare or research side of life. However, we do focus also on dementia, which is also why I'm here. I was particularly interested in Ms. Kivelto's contribution. And what you said about the multi-approach prevention work and combined interventions. Now, for us as Commission, to support member states in rolling out interventions, we need those interventions to be shared. So I don't think our problem here is that we're not aware of the importance of acting. So we don't need lobbying, but we do need you to share the knowledge about interventions on our best practice portal. This is a not very well known phenomena, maybe, but the best practice portal, which you will find on our website, and I will, if you want me, I can share a link to it, is an essential element in how we can support member states to implement practices that work. Whether they are on cancer prevention or on dementia or on health, or, overall health promotion, this is where we start our search. And so if you have evidence on a combined intervention that works, please share that on the portal, so that when member states, they have to prioritize this issue first. I mean, that's always our starting point. We support member states. But if member states are interested in this issue, that is a lot easier for us to say, ha, we have some really good interventions. They will also be validated through the Joint Research Center. So it's all pretty, objective process. But please share what you know. So only then we can use it and see how we can support the implementation once member states think this is worthwhile. Thank you.
If I may just quickly comment, that's a great example. And what I think has been sometimes lacking, that we as researchers are so focusing on the research, but the communication after that, how to do it in a more systematic way, using these kind of channels, I think so important that we can facilitate the process. It takes often too many years to implement that. This is partly surely because it's not communicated in a very clear way. So this is great example. Thank you so much.
Well, thanks a lot. I mean, I remember, the conference in The Hague, last time you were all together, a very good presentation from a Dutch professor. Her first name was Wiesje, which I remember because I'm also from the Netherlands, about, IT and apps and all kind of e-health, how wonderful the research is that you're all doing, but that, 97% of the applications that are being developed are ultimately not taken up.
Mm-hmm.
Mm-hmm.
So,
yeah.
that made a lasting impression on me.
Yeah.
And really, the role that we have, in DG Santé at the moment in public health is very much about support for member states.
Yeah.
So we need the tools. I mean, we have a new program soon. You will find, the EU for Health program very soon. In a few weeks' time, you will be able to read, more about the work program for the next year. But the starting point is please share your best practices with us so that we can implement.
One more note, what I thought, what you mentioned, Frank, as well, that sometimes the length of some European project is a bit limited for our purpose. Exactly when we are ready with the results, then everything ends and the kind of consortia is not anymore there. I think we are losing a little bit kind of speed there, that then it gets not as systematic. So somehow we need to find a mechanism how to take care that when the results are then ready, they are also communicated in a more systematic way.
Yeah, well, obviously, I can't speak for my colleagues at DG Research. I mean, that's a different DG. What I do know is that the kind of projects that we're funding or co-funding through the health program, all of the big, joint actions in the past 4 or 5 years include a work package on sustainability.
Exactly. Yes.
So,
yes.
that is there, but they are not the big programs that you as researchers will be looking for, because they're obviously Horizon, Europe Horizon 2020. But at our humble end of life, we are trying.
Thank you very much. It was really good remark, both remarks and question and answer. And I think that it is the role of Alzheimer Europe to connect these two worlds of research, participating in different projects and communicate it to stakeholders in different places, not only on national, but especially on European level. And I would like to thank our staff that is doing fantastic work in this area, and also our national societies. I am very pleased to be able to say it, because I think it's really much appreciated. And I think we have two other discussion points. Gladys, may I ask to read it because in chat, because I cannot see it now.
So there's one question from Matt Lowling, who says, is there a potential difficulty that the modest benefit to date of the new drug modifying therapies will not encourage people to come forward until the gains are more significant? And then we will have a second question as well from Magda Solaki.
Would you like to respond this? I think it's more a remark than a question, but if you want to respond to it, you are most welcome. Or we can discuss it also later. And
well, yeah, I think so. That's also a question of discussion and framing and explaining the fact that we have now a first disease modifying drug that actually modifies the disease, but the discussion is how to translate that into clinical meaningfulness. And the argument is that it wasn't found in the trials in a very convincing way, actually 2 trials that had different signals. But remember, it needs time. Because the disease is already 15 to 20 years there, and if you start to intervene, remove the amyloid, it will take a lot more time than the trials actually are, usually 18 months, to show a clinical benefit. But ultimately, the benefit will be there. But the trials were just too short, and also some other things happened in the meantime that Frank already explained. So I think this is to us to explain to the people, this is actually a treatment that will modify the disease in your brain, and ultimately you will benefit from it, but you will not notice it the next day because it's not a symptomatic treatment. And I think people will be motivated to come to the clinic because ultimately we will provide a disease modifying treatment.
Thank you for this explanation and opinion. And I think
maybe I can add here.
Yeah.
I think the expectations in our field seem to be very high. So, I mean, people seem to expect like the magic drug or whatever, which cures the disease or fully holds it back. And this will not happen because, as I said many times before, Alzheimer's disease is a very complex brain disease, and it will probably take more than one mechanism to address early, independent of primary prevention. To really slow the disease. And also, like Mia said, maybe the combination of pharmacological and non-pharmacological intervention and so on and so on. And like many other chronic, slowly progressive diseases. And I think we have a milestone here in terms of a concept. For the first time, we can actually intervene with the pathology. But of course, the clinical effect size has to be larger in the future, and it will be larger in the future, but the expectations have to be basically adequate, you know, and sometimes I have the impression in the Alzheimer's field, if there is not a super strong full effect, everybody says this is a failure, and this is not the right attitude toward this scientific process.
I agree.
Not the miracle pill, yeah. And the next question is?
So the next question was from Magda Solaki, so I will let her ask her question herself.
Eva, I have to go. I have another meeting at 4, so I really have to apologize. Sorry.
Thank you very much, Philip. Our pleasure. Thank you. Much appreciated. Bye-bye.
I would like to thank all the panelists and very good scientists who presented to us an overview of Alzheimer's disease. And I would like to ask them what will happen with the other monoclonal antibodies which showed that they had also a decrease in amyloid burden in the brain of Alzheimer's disease. what will happen? Are there any ideas how FDA will calculate all these items which are ranged after this approval?
I think that is a very question. I think that one antibody which was also capable of reducing amyloid was bapineuzumab, which is somewhat long ago, and there was no clinical effect at all. And the others currently in phase 3, like gantenerumab and the BAN17, whatever the number is, they are still, you know, before the submission to the FDA. But I think your question is it's a very interesting question, and I think we are all curious to see how this decision will go. Even more, we are curious to see how the decision in Europe will go. I mean, how will the EMA react to the data of aducanumab, and how will the EMA react to the decision of the FDA? And this will be a very exciting time when by the end of this year or beginning next year, I think we will get that decision.
Thank you very much. And we have a last question. Do you see it, Gladys?
No, I do not.
No, there is not. But we are pretty on time. Last minutes, and I would like really thanks to all our speakers. It was fantastic to be with you, despite that virtually, but still the connection was fine. So I think we really enjoyed it, and I would like to thank also our attendees who stayed with us until the last minute. I would like to once more to thank Deidre Clune for her continued support and for contributing at the beginning of the meeting, as well as to other attending MEPs. And now it is the time of forwarding you the box of chocolate, but today it is only a virtual one. So sorry for that, and I hope to improve it in the next time in the European Parliament at the meeting there, not virtual. I would like also to thank the silver and gold sponsors of Alzheimer Europe who make these meetings possible, namely Biogen, Eisai, Lilly, Roche, and Taurex Pharmaceuticals. And I think that's all, because we have already mentioned all important things in our discussion. And therefore, I would like to thank you all and look forward to further work being done in this area, and to the next meeting, workshop, which will take place virtually on 28th September 2021 this year, and will be dedicated to the Innovative Medicines Initiative. So thank you very much. Have I forgotten something, Jan?
You've covered everything.
So thank you. It was our pleasure, and look forward to meeting you next time.
Very much.
All right. Bye-bye, everybody.
Thank you.
Thank you, Eva.
Bye.
Thank you. Bye.
Goodbye.
Bye.
Thank you. Bye-bye.
Thank you. Bye-bye.